Hi Farah, how are you? Hi Dini, I'm good. Am I interrupting you? Nah, I'm good. So, why are you suddenly video calling me? Any problem? Yeah, I have some question to ask you since you know a lot about blood. Yeah, I will try my best to help. So, what's the question? Okay, can you please explain to me about a little bit about Febrile Non-Hemolytic Transfusion reaction? Oh, the acute transfusion. Okay, so basically there are 5 things that you should know. I will explain it briefly, but please let me know if you don't get it. Okay, so the first one will be the etiology, or known as the causes. Most febrile reaction that occur during red blood cell transfusion are caused by the interaction of leukocyte antibodies in the recipient's plasma with the donor leukocytes, stimulating the release of pro-inflammatory cytokines such as interleukin 1, interleukin 6, and also tumor necrosis factor alpha. Okay, so patients who have multiple prior transfusion or pregnancy are more likely to have these antibodies. So 2/3 of these antibodies are HLA specificity, while 1/3 are specific for platelet or granular antigens. Antibodies usually reach detectable level within 1 or 2 weeks after transfusion, and they are often temporary. Okay, that's on etiology. Are you clear with that? Yeah, that part I got it clear. So, what's the next in the 5 things? Okay, next we have the pathogenesis, or in simpler word, would be development. Okay, so pyrogenic or inflammatory cytokines released from activated leukocytes, commonly from donor during product storage. Cytokines lead to production of prostaglandin itu, causing the hypothalamus to increase the body temperature. Okay, then non-immune mediated, usually associated with platelet transfusion. Passive transfusion of accumulated inflammatory cytokines in the plasma of the transfused unit. Immune mediated, usually associated with red blood cell transfusion. So there are 2 general mechanisms. Recipient antibodies, mainly anti-HLA, activates donor leukocyte to release cytokines. The other one would be recipient leukocyte activated to release cytokines by immune complexes formed from recipient antibodies and donor leukocyte. So other non-HLA antibodies have been implicated, including those directed against human platelet antigens. I think that's it for the pathogenesis. Are you okay with that so far? Yeah, I'm good. You have explained 2 things about febrile transfusion reaction, but now I am very curious about the symptom. There must be symptom, right, that shows the reaction. It's true, there are symptoms for the reaction. Okay, so the symptom are fever. There will be an explained fever, which the temperature of the body will be more than 38 degrees Celsius. So there will be chills, there will be some respiratory changes, there will be some general discomfort. Some will have nausea and also headache. Okay, let's say, okay, someone have all the symptoms that you mentioned just now. So what do we have to do to confirm it? So here is where the lab diagnosis came in. So we have direct antiglobulin test, or known as DAT. Then we have full blood count, FBC. Then we have another one would be repeat ABO grouping, but patient with repeated febrile reaction, so they should be investigated along with the HLA antibody. Okay, so far all the explanation you tell me, I'm 100% understand it clearly. So what's next on the list? I'm glad to hear that. So moving on, we have the treatment and prevention. Okay, so for treatment, stop transfusion immediately. Then we have to notify blood bank or the transfusion medicine service for reaction workup. So by doing reaction workup, they will do the direct antiglobulin test, the FBC, the one that I told you just now. Then another one will be the doctor or the nurse will do a close observation on the patient frequently on the vital sign, and if the patient still have the fever above 38 degrees Celsius, so they will treat the fever with an antipyretic or meperidine for severe reaction with rigors, chills. And for prevention, we will use acetaminophen if fever persistent. So some will use plasma reduction or wash product if severe reaction occur. Wow, I'm glad that I make the decision to have a video call with you to ask you more about the febrile transfusion reaction. Anyways, thanks you very much for the explanation that you have told me everything about the 5 things. It's okay, just helping with what I know. Yeah, I mean, like, I'm really appreciate it. Thank you so much, and please take care. Don't mention it, and please take care too. Bye.